Hey everyone, this is David Ellis, and I'm here with Amy Kruzek. And today we're going to be delving into another aspect of healthcare, which is the medical aesthetics aspect. I asked Amy to come prepared with a bunch of questions. I do medical aesthetics where I live, and a lot of people have misconceptions, and so this show is about empowering, educating, and connecting people. So, Amy, introduce yourself and let's get right into it.
Hello, everybody. Amy Kruzek here. Okay, so David, tell us about, let's see, what do I want to start with? Body contouring.
Okay, so medical aesthetics, I want to just make a definition here. So, a lot of people don't know what that is. So, let's start with the fact that medical aesthetics is different from your regular esthetician, in that medical esthetician will do interventions of different kinds. So an esthetician will do your hair, your manicures, your pedicures. That really they do hair coloring. They definitely do nails and pedicures and different kinds of pedicures, right? I believe some estheticians do waxing as well.
Mm-hmm.
A medical esthetician does other interventions, more aligned of the invasive route. So they will do stuff like cryolipolysis, body contouring, which you just mentioned, and a number of different modalities, which are geared towards changing the aesthetic appearance of people. So, having said that, there are different kinds of medical estheticians. A medical esthetician takes a certain kind of training, and you have to be trained in every modality before you try it or offer it. So a medical esthetician would have to have insurance, for as an example, and they would have to register with the national board in Barbados. Not in Barbados, in Canada, it's the Canadian Association of Medical Spas and Aesthetic Surgeons, as an example. We use medical aesthetics when people have an aesthetic issue which they would not have overcome by any natural means. Okay? So there are some situations where it's absolutely advised. Let's say post-operation, if you want to reduce the look of a scar on your body, as an example. A lot of people have taken the medical esthetician thing way too far. They're giving it to people who just have vanity problems or psychological problems, which I don't know how I feel about that. I mean, it does make money for them, but I just think that it's something that we've taken a little bit too far in our society. So here's the thing. Body contouring is a perfect example of that. Let's say you are an overweight person who is going to the gym. You have lost weight everywhere on your body except on your stomach.
Mm-hmm.
There may be a reason for that. You see, the body does different things depending on who you are. If you are the kind of person who has had a cesarean section, the body will deposit fat underneath the scar if it's a lateral incision, right? So, as a protective mechanism as well, okay? So no amount of dieting, unless you go on some extreme diet, and no amount of sit-ups is going to get rid of that little pocket of fat that's underneath that area. Because the fat has been deposited there and it has a protected status in your body. So body contouring, cryolipolysis would come into play here because we can get rid of that pocket of fat that's in that particular area. But a lot of people go to a medical esthetician and they just want fat removed everywhere, all over their body without having to exercise, without having to diet and be responsible for their own appearance and their own aesthetic appeal. And to that, the responsible medical esthetician would probably say something like, no, I'm putting you on a diet.
Yeah.
Or I'm going to send you to a nutritionist to put you on a diet.
What about, extreme people, overweight, and then lost tons of weight, and then they have, the fat.
Loose skin?
Yeah, the loose skin.
Okay, so that's another treatment modality which I'm certified in. It's called HIFU, which stands for High Intensity Focused Ultrasound. And so what that does, it tightens up the subdermal layers, all right? And I don't want to get into an anatomy lesson here, but your skin has different layers to it. And we can tighten the layers underneath utilizing HIFU, which can tighten up your skin if you've lost a lot of weight, right? And you have loose skin that is all over the place. That, once again, the body is not going to change that, right? Because the body doesn't see necessarily anything wrong with the loose skin, right? As long as the body is a survival device. So as an example, if your skin is intact, it will not change the skin necessarily unless, of course, there is a problem, or unless the medical esthetician creates a problem that will cause the skin to reform itself.
Yeah.
So in the body contouring example, what we do a lot of the time is we'll either use radio frequency or ultrasound. It heats up the layers and the fat cells that are there. So depending on what the client presents with, we're going to be using a different intervention for a particular area. Not all interventions are created equal. Okay? And some of them are a little bit invasive and not necessary under certain circumstances. So as an example, if somebody went to the gym and they lost a lot of weight and there is no issue, they just need to work a little harder, then medical aesthetics is not necessary. Okay? So I think a lot of people have taken this a little bit too far. So in a body contouring situation, is when somebody's actively exercising, they need assistance with drastic weight loss because they're working with a time frame. As an example, somebody's about to get married. They're working with a time frame. They want to fit into a dress, or they want to look good in a particular dress. And that is what is necessary for that purpose. So you would use body contouring. What I would do is simply utilize a machine. We have a Kuma X machine, and what it does, it heats up the fat cells that are in a particular area, and it causes cell apoptosis, which means that the cells die. Only the fat cells die. The cells of the other remaining tissues around the area are left unharmed because it's at a specific temperature that kills fat cells, and your body gets rid of the fat cells. You either pee them out or your body reorganizes the material in a different way. It's the same for cryolipolysis. So cryolipolysis, you're not going the heating route, you're going the freezing route. They call it CoolSculpting. The benefit of cryolipolysis over radio frequency is that you will continue to lose fat in that area over a period of 6 weeks, on average.
Oh, with the CoolSculpting or with the heat?
No, with the CoolSculpting.
Oh, okay. Okay.
So it's actually useful if you are in an active exercise regime to use CoolSculpting.
It's non-invasive, right? It's non-invasive.
So we will not break the skin in CoolSculpting. No. Basically, you are put on device is put onto your body. It sucks the fat up into a cup, and it freezes that fat and causes the fat cells to die. And then your body will process that over a period of 6 weeks, which means that you will continue to lose size and fat cells in that area over a period of 6 weeks while your body gets rid of that area.
Got it.
So, I mean, a lot of people don't understand how these things work. I suppose it's our job to try to educate them. But cool sculpting and radiofrequency, they depend on cell apoptosis. We kill the fat cells in a particular area and they are processed accordingly.
Okay, something came to mind here while you were talking. People might think, oh, I can use it anywhere in my body, on your body, but you can't, especially the breast area. You can't do that. Like if you're...
Theoretically, you can use radiofrequency on the breast to a certain extent, but it's not advised. It's not exactly the most comfortable sensation you would have. We do have an attachment for the double chin.
Oh, okay.
But I can pretty much tell you for the cool sculpting, but I can pretty much tell you that adding cold to that area is uncomfortable. So some of the treatments are uncomfortable. It depends on your level of discomfort and so on. I wouldn't say that they're at a 10, right?
Yeah.
But they're uncomfortable when you start them.
Ah, okay. Okay.
I think like the butt area as an example, or the waistline.
Yeah, thighs.
The hip area,
Yeah.
the back area, they're big areas and they're easy to deal with. Small areas like underneath the chin, as an example, are a little bit more difficult. All right. So honestly speaking, it depends. You see, the thing about it is that the human body is very interesting. Sometimes you may not have to lose fat in an area. Sometimes you just need to build muscle in the area, and then things look aesthetically pleasing. Because everybody seems to think that they have a lot of fat to lose, okay? Until they meet a 350-pound person, okay? And they realize, okay, probably I'm not that bad, right? So yeah, a lot of people think they have a lot of fat to lose. It's advised that you go the nutrition route and the exercise route and so on. And that's why I actually studied nutrition as well. Because just throwing medical aesthetics, a lot of people go to people who do medical aesthetics, but they don't have backgrounds in other modalities. And so the medical esthetician is going to try to drop a whole bunch of fat in your body, utilizing the equipment that's in their office or in their salon or whatever the case may be, or wherever they're practicing from. And that's a dangerous thing. Yeah. It is a dangerous thing because you can, there's a limit to the amount of intervention that you should do. Okay. Yeah. I have heard of people going to get like 6 HIFU treatments in the space of 3 months. Okay. No. That's excessive. It's high intensity focused ultrasound for a reason. And I think that a lot of people have gotten out of the habit of just trying to do it the natural way.
Yeah, and in a hurried kind of way, right? The body needs to get used to that, what just happened to it.
Correct.
Yeah.
You need spaces in between that.
Yeah. Okay, so tell us about laser treatments.
Okay. So there are different kinds of laser treatments. A lot of people, and I want to give a word of caution here. When your therapist is using a laser on you, the things you should look out for are the following. Were you given protective glasses before the laser treatment was initiated on you? Because lasers are not a joke. Okay? Lasers burn. I mean, like, remember Star Wars? You know, the guys with the rifle. Lasers burn, and you have to take certain precautions. In certain countries, like in England, when you are utilizing a laser, you're supposed to put a sign on the wall saying laser in progress, meaning that somebody who walks in, the flashing of a laser can blind you. It absolutely can. It will certainly affect your eyesight, right? So the therapist usually wears protective glasses, and the person wears protective glasses as well to avoid macular degeneration of any kind. So what you might want to do is do that check with your therapist, okay? Now, there are different kinds of lasers. There's the IPL, which will remove hair on an individual's skin. And the way that works is that we, for want of a better word, burn the roots of the hair follicles. And there is no hair removal that's permanent. Let me just say this. So if you see a lot of medical estheticians have this stuff like permanent hair removal, no, the body doesn't work that way. The body will find a way to put hair back on that on that spot.
Oh.
And so what they mean is very long-term hair removal. That's what they mean. But you're gonna have to come back after 5 or 6 years to get that done because the body will reform itself. Absolutely, it will. And so what it does, it basically, the laser is calibrated to burn the roots at a particular level, and hair does not grow back in that area for a while. So that's what you call IPL laser hair removal. Now, when I say that, people think, oh, that's going to hurt. No, it doesn't hurt as much as you would expect because that is a very carefully calibrated laser. And what it does is actually just singes you out a little bit. So in terms of pain level, you won't get past a 4. Okay. So a lot of people think that that's going to hurt, and it's not. There is a YAG laser that we use for tattoo removal. And so for those of you who have tattoos out there, like, I don't know, when you were young, you tattooed a swastika on your forehead.
Oh, God. Oh, my goodness.
You tattooed a swastika on your forehead and you want it removed because you don't know, I don't know, you probably want to get a job now or something, and probably that might be preventing you from getting that job. Let me give you some advice. If you're going to get a tattoo, please get the old-fashioned charcoal, you know, the black tattoos. They're easy to remove. Don't get the pastels.
Oh.
Okay? They're easy to remove when you have the black tattoos and so on. Because, and I'm going to give you the process. So you know how you get a tattoo, right? In the tattoo removal is a little bit more intense, because we literally have to pop the ink underneath your skin. So what the laser does is it pops it, it will dissipate the tattoo, it will look like it's coming back, and then your body will get rid of it, okay, over a period of time. So yeah, so tattoo removal is very, very tricky thing. I mean, it is absolutely possible. Best to choose wisely in the first place, you know, like swastika on the forehead, I don't know, upside down on the forehead. It's probably not a good idea. I had to take the tattoo of a young lady's arm, and I don't do that often because I generally don't like having to do that. I actually took a video of it. I wish I had set it up so that everybody could see it. She tattooed on her wristlet, this area right here, his heart. I kid you not.
His heart.
The words "his heart." Okay, I actually have that video. I had to take the video. She allowed me to take it and use it for promotion. So she regretted that, obviously.
Yeah.
Things didn't work out. And I had to take out the laser. I had to laser that area, and yeah, depending on where it is, obviously it's going to be as uncomfortable as getting a tattoo in the first place. Okay, so
I was going to ask you if it's as uncomfortable as getting one. I don't have one, but I've heard how uncomfortable it can be in certain parts of your body.
It is. Getting rid of it is equally as uncomfortable because I can pop the ink underneath the skin, which is, a little bit dicey, right? And so we use that laser for that. We use other lasers for facial makeovers. So you can use a laser to tighten up somebody's facial skin. You could use it to get rid of rosacea and different other skin or dermal issues that an individual may have.
Can I go back to the hair removal?
Sure.
I've read where it only takes the dark hair, not the blonde hair. Is that true?
Yes. Here's the thing. Well, we've come a little way past that because now they're green light lasers, right? But anyway, uh,
Oh, okay. Yeah.
here's the thing. When you're doing hair removal, it's not a good idea. It used to be not a good idea for certain skin types. Okay, so blonde hair is a little bit difficult because our lasers get to look for a certain color spectrum.
Mm-hmm.
And if your hair is nice and fine and blonde, it's not going to see anything. Okay,
Yeah.
the machine is not going to see anything. Dark hair is fine. And here's the negative aspect of this thing. If you have dark skin, it used to be that if you got lasered, it would turn your skin white, right? And I don't mean a good kind of white either. Okay?
Oh, no. Okay.
Right? So if a lot of therapists have white beds, right? The reason why they have white beds is because when they make mistakes and they accidentally hit the bed with the flash of the laser, it's not a big deal. If you have a black bed, it will turn the black bed white.
Oh,
So
okay.
that will, and it will do the same to skin as well. So you would have like a spot on your skin if you have dark skin, which is definitely not in blending color with the rest of the skin in that area.
No. Oh, okay. So that's good to know about that. But you're saying they have green light now? That's for
There
blonde?
is a green light laser. It's very, very strong. A lot of people have received burns from that laser. So
Oh,
I wouldn't, it's not
yeah.
something that I would actually take into consideration.
No. Okay. So tattoo removal. What about spider vein removal? How does that happen?
All right. So spider vein removal. For those of you who don't know what spider veins are, they are the little red and purple veins that show up on the outer layer of the skin. So we use a spider vein removal machine. It traces the vein and it flashes a laser into the vein, causing that vein to be broken down and removed from that area.
Mm.
Okay? So it will remove the vein underneath the skin.
What causes them, by the way?
A number of reasons, like if you have blood supply in a particular area that has been removed for whatever reason, right? And the vein just develops naturally, okay,
Oh,
in that area.
okay.
All right. Remember that arteries are what the heart uses to supply blood to the body, and veins are what the body uses to bring the deoxygenated blood back to the heart and lungs.
Okay. Okay. So what about red light, blue light, yellow light? I think that's a book. It's a story. It's a kid's. I think it's a kid's book. But
That's also a nursery rhyme: red light, yellow light,
yeah,
blue light.
blue light, blue light.
I remember. So, red light therapy is very, very useful in the medical field and in the medical aesthetics field. What red light therapy or infrared, depending on the spectrum of light that you are using, right? So, red light therapy will cause your skin to reform itself. Okay, it absolutely will, right? Depending on the intensity of the light, it will go through your body. It will actually affect a lot deeper than just your skin. It will affect your organs as well, depending on how you use red light therapy. Okay.
Can I ask?
Infrared therapy is a higher spectrum and it goes through your entire body. For those of you who are wondering, well, I'm not affected by infrared therapy. If you step out into the sun, especially in certain parts of the world right now, you are absolutely being exposed to infrared therapy. And so, red light therapy will cause the dermal layers of your skin to contract and relax, and the epidermis, which is the part that you can see on people, begins to reform itself. It clears itself up.
Okay, can you get that same effect in infrared? Is this different than infrared sauna?
An infrared sauna, you use an infrared sauna when you want to increase heat and you want to pass it through the body, okay? So you want that person to sweat, you want the sebaceous glands working. The person will absolutely be affected by infrared, right? Red light therapy, however, is a kind of, for want of, I don't want to have to use this word, but it's more like a nurturing kind of light. It is part of the EM spectrum that is coming off the sun. It's just isolated and condensed for a particular purpose. A lot of people use red light therapy, whether you're using the LED masks or whether you're in an office like mine where we use a medical grade red light to go through and reform skin in particular areas. So that's what the red light does.
Okay, wait, hold on. Before you just said red LED masks that you can buy, you can get them in the drugstore, right? Is that, so you said medical grade, so there's different grades. Is it worth getting those at the drugstore?
Not all LED masks are created equal.
Yeah.
Yeah. So the purpose of an LED mask is to put the red light as close to your face as possible. It's a lot less invasive than putting a laser to your face. All right. And so the red light penetrates into the pores and the layers of your skin, the subcutaneous layers as an example. And what it does, it reforms the skin from the inside out. Yeah. So red light therapy masks, do I suggest that you get them? Yeah, you should. Okay?
Oh, yeah.
Yes, but please don't buy the cheap mask at the drugstore.
Please. I know. That's what
at the drugstore.
That's what I was trying to get to. Like, invest in a little more, medical grade.
If your mask costs $9.99, no.
No. Yeah, watch out. Amazon too might have them. Yeah. So go ahead. Blue and yellow light therapy, which I've never heard of.
Blue light therapy, you never heard of it because it's in terms of, if you had to compare blue light to herbal medicine, blue light would be the astringent. So bacteria do not like ultraviolet light and they do not like blue light at all. They don't. Okay, it causes a problem with their biology and their DNA, right? So they tend to break down under blue light and ultraviolet light, which is why we clean things with ultraviolet light. Okay, instruments in a medical environment and so on, they either use high temperature, which you can't use on plastics as an example, or they use ultraviolet light. It breaks down bacteria and microbes. And blue light does that. So you could put blue light over somebody who has acne. Okay, or acne, right? And obviously you could use blue light in the case of like somebody who has a lot of rosacea, pimples, and that sort of thing.
Eczema? How about eczema? Psoriasis?
I would probably use a combination of blue and red light.
Blue and red with that. Okay.
Yeah, so that's basically what the blue light does.
Okay.
The yellow light, intense yellow light, what it does, it gives you the glowed up appearance. It is what the Instagram models utilize. It's what the Instagram models utilize to go and...
It's like a serum. It's like a serum.
to make that post and so on. So people who are using therapeutic yellow light as an example, they appeared all glowed up and so on. So what is it used for? Let's say if you were about to get married and you want to be the only one at the wedding that is like a beacon of light, you would probably use yellow light therapy. So people use that to glow up, so to speak, and your skin responds to it and gives you that what is the word that they say to women who are pregnant? You're glowing.
Oh, you're glowing. I was just thinking that. I was like, or you could get pregnant and have that glow.
I don't think they would. People want to go out and scream, right? right? You could get pregnant without that close. So a lot of people generally tend to use the yellow light for that purpose.
And this is for men and women. So guys, don't be afraid to use it, right? We kind of have to break that stigma
But
that this is for men and women, all of this that you're talking about.
funny enough, men are utilizing it quite a lot, actually.
Oh,
Let's talk about the concept of Botox and so on. Okay.
yeah.
I may have a personal opinion about the Botox and the invasive fillers and stuff like that. But it's not necessarily a universal opinion. It looks to me, I generally tend, when you're speaking to people, this is why I don't do fillers and I don't do that kind of stuff. Okay. The reason being that it literally changes the appearance of the individual and not for the better.
No.
Okay. I will just say to whether the women or the men who are watching this broadcast, as close to the natural look as you normally would have is a good thing. Okay.
Yes.
Do not poison yourselves just for the sake of looking like, what is this lady's name? Kim Kardashian.
Yeah, the Kardashian, all of them actually.
Do not poison yourself for this reason. Okay. Now, a lot of people tend to have psychological issues that require them to see a counselor. But generally speaking, I think if you're a medical esthetician that is worth anything, you will counsel people before you decide that you are going to use an intervention.
Yeah, because you know what? You don't know later on, 10 years from now, 20 years from now, what is going to happen. And you have to keep up with it. What happens when you're like, oh, 5 years, I've had enough of these fillers. I'm going to let everything go. Do we know what's going to happen?
Agreed.
Right? Like, we don't know. And why would you want to find out? Because, yeah. I get Botox for if you have migraines or something medical, right? Yeah.
I think a lot of people seek aesthetic help when it is that they feel the depression. But the thing about it is, aesthetics is the kind of thing that can be addictive.
Yeah.
If you are preparing for a wedding, aesthetics, depending on how hard you're working in terms of nutrition and diet, is a good thing. But if you are not preparing for something and you have the time in your hands, please go to the gym, see a nutritionist, and then you make a plan based on that.
Yeah.
I am not a good advocate of fillers and Botox and any of that stuff. Right? People say, well, it works. No, you think it works.
You think it works, right? It's good. It might look good for right there, but who knows once the swelling comes down?
Yeah, who knows when once the swelling comes down? Correct. I think that's it. The other interventions that we do are EMS, which is basically EM sculpting. What we do is we place a paddle on an individual and we run a particular voltage of current. Don't worry, it's not painful or anything. And that machine, what it does, it builds muscle in a particular area.
Oh, that's cool.
It's very, very cool.
Interesting.
So who would use EMS and who would use, let's say you're a bodybuilder and you're preparing for competition. You are 3 months out and you still have some fat around your waistline, right? And your quads are not looking as they should. You would probably go into an office of a medical esthetician and you would say, I need to get rid of that little bit of fat that's still around my waistline. The medical esthetician will absolutely get rid of that for you. all right, and I need my quads looking more defined at the heads, the heads of the muscle.
Mm-hmm.
So the medical esthetician would probably utilize EM sculpting in that area, because that can give you like about 70, like 7,000 lunges in the space of an hour,
Wow.
without the lactic acid effect. So it's useful. It
Mm-hmm.
absolutely is useful. I know a lot of bodybuilders who go that route, and Instagram models go that route every time they post.
Wow.
So if you're having issues about, oh, I don't look like that Instagram model, or I don't look like that guy who's the fitness influencer and so on, feel better knowing that they have secrets that you don't have,
Yes.
which
Oh,
are just exposed, which is a wonderful thing.
that's a good point. See, you're good at what you do because you're not going to go overboard with people. You're going to just say, if this is what you need, this will,
Here's the thing. In any profession, you need to be able to tell your clients no.
Yeah.
In any profession, you should tell your clients, no, you have had enough.
Mm-hmm.
Medical estheticians, if you guys are listening to this, you need to be able to tell your people no. Okay? Somebody says, I had a CoolSculpting, CoolSculpting. I lost half an inch. I want to lose 3 more inches. So I'll just take more treatments. Tell them no, because that is a cell dump in your system.
Yeah.
The cells die, your body gets rid of it. You gotta wait 6 weeks in between the treatments, right? But people don't want to wait that long. They said, oh, it's working. Let me lose a whole bunch of stuff. And just to be clear, everything in medical aesthetics works because it's already been scientifically proven.
Mm-hmm.
So, like HIFU as an example, there was a big controversy about vaginal HIFU. Let's just talk about that.
Okay.
So vaginal HIFU is when a HIFU instrument is inserted into the vagina, and what it does, it tightens all the skin in that area. All the tissues and all the skin in that area become tightened as a result of it. And women were flocking to get this procedure done. Okay. They were flocking to get the procedure done, not for themselves, although I will say it also helps with urinary incontinence. So a lot of people did do it for themselves, but they're getting this procedure done because of men.
Mm.
And my response in this situation like that is, first of all, I will never do a vaginal HIFU procedure. I was trained to do it. However, I wouldn't do it specifically. Because, it's just difficult to explain, and there are other concerns. This is a kind of procedure where hygiene is a very big factor. Okay. And I think a lot of people don't understand what the process entails. It entails inserting an instrument into the vagina and turning an ultrasound device on inside of you.
Yeah.
So a lot of people were very happy with the results, obviously, when it first came out and it became a thing. Because let's face it, going back to the beginning is whatever, right? As usual, people took it way too far because they really want to go back to the beginning. And so they had multiple vaginal HIFU treatments, and then you find it might have difficulty peeing, as an example. Okay, too tight.
Ah, gotcha.
So this is the kind of thing, because it's not going to just choose one set of tissue to tighten everything, right? And so for those of you who are out there, I mean, there are people who do vaginal HIFU. I think you do have vaginal HIFU when it is the following things exist, the conditions exist. You have urinary incontinence, or you've had a particularly traumatic childbirth, and the pelvic floor exercises are not enough for what you want to do to reform that area.
Yeah.
That's when you would use it.
Good points. Well,
I hope I covered that.
You did. You sure did cover that. That was good information. It's very good. Okay, so one other thing you do is facial skin analysis.
Yes.
But you don't do facials, do you?
No, I do not do facials. No, I don't do facials. Well, I do photo regeneration for the face, which I suppose is a kind of facial.
Oh.
Reconstruct the face.
Okay.
In the face. However, a facial skin analysis, before you do anything, let me just say this to you guys. If you're going to a medical institution that does not have a facial analysis machine, you need a different therapist.
Ah.
Okay, because what the facial analyzer will do, it will break down what is going on with your skin before you add a laser, a HIFU machine, or any other thing to it. So you check the face, the skin first. So what the facial analysis machine does, it magnifies your face. It takes several photos of your face with different kinds of lenses, whether it be a UV lens or whatever else. So before you go, messing around with your face, even if you don't want to go to a medical esthetician for any kind of interventions, you should get facial skin analysis. And for a limited time, we offered them free to any clients who were interested. So what it does, it gives you an accurate description based on evidence as to what is happening with your skin, what part is dry, what part is affected, which part has sun damage, whatever the case may be. Very important to do before you go putting interventions across somebody's face. For those of you who are medical estheticians, get yourself a facial skin analysis machine, because then you know exactly what to do and what intervention is prescribed for that person, as opposed to just winging it based on what it looks like.
Yes. I know you showed me pictures of what you do, and they were like, wow, all of it shows up, all of it.
Everything that is wrong with your skin or whatever else will show up on the facial skin analyzer, and it is very important to have that device, especially if you are a practitioner. A lot of people forgo that and they just wing it.
Yeah.
Because as far as they're concerned, people just want to look good. No, people want to look good safely.
Yeah. Yeah.
Okay.
Yeah.
Right? People want to look good safely. Let's be safe about it. Okay, so yeah.
Yeah.
Adhere to your training, get a facial skin analyzer machine, and know what you're doing before you do it. And if you guys are clients and you want a report about your facial skin analysis, you can either contact myself or you can contact Amy, who will contact me. And if you're not in my area, what we can do is get you to somebody who's in your area who does that service. Because if you want a report on your skin and what it looks like and what it's doing, and the areas of your skin that are damaged, that a laser might further damage if you try to use it, or a HIFU machine might further damage if you try to use one, or a red light device or whatever device. If you want that kind of information, so contact somebody who's really trained to use one of these and who can provide you with the information.
Oh, I also wanted to end on asking you about your DNA analysis and hair analysis.
Yes, so
you do that.
I'm one of these therapists that is extremely careful with people, due to the fact that I would like people, when I go to a therapist, to be careful with me, do unto others as you would have them do unto you, that kind of thing. So what I do is something called DNA analysis. So there are different kinds of DNA analysis. There's DNA analysis for the skin, for fitness, for health, right, for diet, etc. And there's the total package where we give you a report on everything. Why is it necessary to do DNA skin analysis or any kind of DNA analysis? Because a lot of people just guess. I don't like to guess. if I'm going to do an intervention on somebody, I want to know exactly what that person is coming into my office with. So I want to know where that person is before I take them to any place where they think they want to be. And I will manage their expectations based on what we're seeing. If it is that your grandmother before her, and your grandmother before that person have had fat deposited in a particular area, please understand that when a medical esthetician takes the fat away, it'll come back.
Mm-hmm. Yeah.
It'll come back because that's what you came in with. Be happy with what you came in with. Be realistic about what you want to do. So I do DNA analysis specific for that because people want to know what their risk factors are.
Mm-hmm.
I can pretty much tell you whether you have certain predispositions based on the genetic markers that are showing up and what you should avoid. For the skin, as an example, certain people have genetic anomalies which are unavoidable. So in that case, you may choose the intervention that you're going to use differently. So as an example, let's say you have your family, most of your family comes from sub-Saharan Africa. You may have a predisposition towards dry skin. Yeah.
Yeah.
Because you're close to the equator. Your people have lived close to the equator. You may live in Canada now, you may live in North America. But adaptation to environment over a period of years, you need to know what you came in with so that the therapist can suggest certain kinds of interventions. And for somebody from sub-Saharan Africa who their entire lineage has been in sub-Saharan Africa, who just migrated to the US and says, I suffer from dry skin, I am going to probably advise, because I would use my nutrition background and change the diet first, as opposed to saying, oh, well, just lie down on my chair. Let me just nuke your face with a laser, and then all of a sudden things will be fine. It won't be fine because a laser, ironically speaking, is hot. Hot.
Yeah.
Okay, so this is why you do skin analysis. And just generally speaking, for everybody who's listening to this broadcast, the DNA will stop your guesswork. It'll tell you what you are predisposed to, what you should watch out for, and the things you should avoid. Really. So you don't have to guess. Don't guess. Guessing
I like
is
that.
bad.
I like that. What about the hair analysis?
Hair tissue mineral analysis. Also, I do that as well. It tells you your present state. So a lot of people are walking around with deficiencies and they don't know it until they drop.
Yeah.
And they end up in hospital and they said, oh, you were severely iron deficient. Didn't you know that? No, I didn't know that. Why would I know that? Because you live in that body. That's why. Okay. Yeah. So hair tissue mineral analysis, what it does, it tells you what the deficiencies are in terms of the minerals in your system. A lot of people are magnesium deficient. I'm sorry, let me rephrase that. 98% of the population is magnesium deficient, and they wonder why they have suicidal ideation thoughts, they have bad moods and mood swings and so on. You might be lacking magnesium.
Yeah, so do they have to do that often? The hair tissue?
I would do it once to get an idea of what my present state is. I would go to a nutritionist, get the adjustments that I need to make the adjustments, and do it about 6 months after.
Yeah, I like that.
Okay.
To see if it's working. To see if,
But you wouldn't have to do it again because let's say you have a bad mood permanently, a bad mood, and you go to someone to get HTMA done, right? A hair tissue mineral analysis done. It will be sent to a lab like the DNA analysis, and what happens is that the person comes back and says, you're magnesium deficient. When that person makes the changes that the nutritionist or the therapist tells them to make, they're not going to need to wonder whether it's stabilized or not. They're going to be happier when it is that they make those changes, right? Something is going to change. And so they're going to say, wow, I must have been really deficient. And I'm going to say, yes. If you're listening to this broadcast right now, possibilities are that you are magnesium deficient.
Yeah. Wow.
And you would need some counseling where that is concerned.
Yes. Well, that was very informative, David. All of the things that you do.
Yeah.
I love it.
I think therapy is a kind of thing where you start on one thing, but you realize that how much you don't know.
Yeah.
And you need to increase your training, right? At my age, I'm still going to be learning stuff and learning more stuff.
Yeah.
So this is basically what the medical aesthetics. I hope this has been informative for you guys who have been watching this, right? If you need any further information from me, you could email me at info@unifiedhealthsystems.com, or you could hit me up on Instagram at Unified Health Regina, or on Facebook at Unified Health Systems, Facebook. So you can do that. Amy, you want to give these people a way to get a hold of you?
Yes. So I am a certified counselor from the IACT Association.
And
from the IACT, the International Association of Counselors and Therapists.
And where are you based right now?
I'm in Pennsylvania.
Okay.
Yeah. Or on Zoom. Yes. Okay, so then you can also reach David and I at the UCM community platform, which that would be great for you to come join us over there at community.universalcitizentv.com.
Yep.
And, well, I forgot to tell them my email is pinkmoonlodgepodcast@gmail.com. And over at the UCM community, so David has these Winexa AI tools and software.
Mm-hmm.
Yes, for building your business, right?
Mm-hmm.
And your website. And, good price point over there. Yeah. And we all, right? And we also,
the price point is free. You get to use
yes.
And if you guys want to buy credits and so on, but we give you credits anyway. So if you guys have businesses and so on, join the community, and we have some tools inside there for you guys.
We do, and we have live certified classes too. One coming up soon, I think, in the fall.
Correct.
Yes. So thank you for joining us, everybody, and take care.
Bye, everyone.
Bye.